It is 100 days since Boris Johnson announced that he was introducing a lockdown. In those 100 days, the UK has been affected by COVID-19 far more than most. And we wanted to take time for a detailed look at the decisions that were taken around lockdown, around testing, and around care homes for the elderly, where the virus has taken a particularly terrible toll. So throughout this edition of Outside Source, we'll do just that. And to start, it's useful to compare the UK with three other Western European nations of roughly the same size. Here you can see the total deaths in Italy, which was the first to be badly hit by the virus, and in France. And then there's Germany, which has seen much lower figures. And here's the UK. In March, it was about 2 weeks behind Italy, but it soon caught up and then overtook Italy. As June ends, the recorded death toll in the UK is almost 44,000. That's higher than the recorded deaths in any other country in Europe. Now, the UK government has consistently resisted these comparisons. Here's the Foreign Secretary Dominic Raab on the 5th of May, the day the UK's death toll passed Italy's.
I don't think we'll get a real verdict on how well countries have done until the pandemic is over, and in particularly until we've got comprehensive international data on all-cause mortality.
Well, the pandemic certainly isn't over, but we are far enough into it that we can now compare recorded deaths from all causes. Let's look at the UK first. This dotted line shows the number of deaths that would usually occur. Actual deaths for 2020 are marked in grey, as you can see. Initially, the UK was below expectations until COVID arrived. The red areas show excess deaths, where the person has died relating to COVID-19. And blue shows the other excess deaths. But some of these deaths may have been caused by COVID. Others could be people who have died because of restricted healthcare because of the pandemic. Add red and blue together, and this is a useful guide. Based on these calculations and adjusted for population, the UK has seen more excess deaths than any other country in the G7 group of wealthy nations. That includes Italy, France and Germany. Here's the BBC's head of statistics, Robert Cuff.
There are caveats to any international comparison, but probably fewer caveats than there were a couple of weeks ago, especially when you use the right data. The thing about looking at the patterns in the total number of deaths is that it's not subject to the same differences between countries in how they record COVID deaths or coronavirus deaths and how good they are at capturing that. So it's a big improvement when you look at that. And particularly when you look at the data now, you see that a lot of countries like the UK, Italy and many others are through that first wave of the epidemic. Deaths peaked in the middle of spring and they've been coming down ever since, and the total number of deaths we're seeing in those countries is probably in and around what we'd expect to see at this time of year. So that picture of the total number of deaths picture is pretty stable now and not likely to change unless something really radical happens. So once you've got those two things, you're in a position where you can start to look back at the first wave and see who's been hardest hit, and then that's a starting point for looking at the differences between those countries and why those differences occur.
So why do we think this happened? Well, there are lots of factors that can make a country susceptible to coronavirus. The UK's high death toll may be connected to high levels of obesity. It may be connected to London being an international travel hub. And government decisions may also have contributed. The UK's first death from coronavirus was recorded on the 5th of March. The government strategy was to lock down gradually, to flatten the curve of infections rather than to stop the virus outright. And some countries were locking down. Public events in the UK, though, continued. The Cheltenham Horse Racing Festival opened its doors to 250,000 spectators on March the 10th. A few days later, the band Stereophonics tweeted this picture of a concert in Cardiff. In fact, they held two on the 14th and 15th of March. And 35 people had already died from COVID-19 in Spain when around 3,000 Atletico Madrid fans were allowed to travel to Liverpool to watch a Champions League game. Ben Johnson attended that match and later developed symptoms.
You just think of them 60,000 people. I'm one of them. I probably wasn't the only one who was asymptomatic and who went to that match. You know, it was obvious that it shouldn't have gone ahead. And I think it was negligent that it went ahead. And there's no fault of the clubs. But I just think it was a poor decision. And I'd be amazed if at some point on that sort of journey from leaving our house to getting home via the restaurants, 3 different pubs, a train, a ground with 60,000 people, you know, queuing for toilets at half time with, you know, 500 people like sardines in a tin trying to squeeze into, you know, 3 urinals or whatever. I'd be amazed if I haven't passed it on to people. I'd be amazed.
Now, it's certainly true the UK was moving more slowly than many other countries, and the threat of the virus was in plain sight elsewhere. But the UK government was taking actions. By mid-March, some social distancing measures were introduced and more measures were promised. And the government maintained throughout that its decisions were guided by science. But that science became a controversial subject, not least after the chief scientific advisor, Patrick Vallance, told the BBC this on March the 13th.
Not to suppress it completely. Also, because most people, the vast majority of people, get a mild illness, to build up some degree of herd immunity as well, so that more people are immune to this disease and we reduce the transmission. At the same time, we protect those who are most vulnerable from it.
Well, herd immunity is an approach which allows a percentage of a population to get a virus, and so immunity develops across the community. Now, Patrick Vallance very soon sought to explain that in that interview he hadn't meant to suggest that herd immunity was government policy. But by this point, the celebrated science writer Ed Yong had written this article under the headline, "The UK's coronavirus herd immunity debacle." His point being it may not have been the policy, but the actual plan was being so badly explained, he argued, you'd be forgiven for thinking so. For whatever reason, the UK wasn't moving as quickly as others. But then this report from Imperial College appeared to change the calculation. It argues that to not act more drastically was to risk thousands of lives. And whether influenced by that report or other advice, the UK did soon escalate its response. Lockdown arrived on the 23rd of March. This was the Prime Minister making the announcement.
From this evening, I must give the British people a very simple instruction. You must stay at home. Because the critical thing we must do to stop the disease spreading between households.
Now, the date of the lockdown matters so much because so much changed so quickly. On the 5th of March, the UK had fewer than 300 cases. By the end of the month, there were 32,000. And some scientists who were advising the government at the time now argue lockdown should have come sooner.
The epidemic was doubling every 3 to 4 days before lockdown interventions were introduced. So had we introduced lockdown measures a week earlier, we would have reduced the final death toll by at least a half.
We should have gone into lockdown earlier. I think it would have been hard to do it. I think the data that we were dealing with in the early parts of March and our kind of situational awareness was really quite poor.
And we should be clear, the decision to not rush into lockdown was taken while other countries were taking more drastic action. For example, none of those live events I outlined a moment ago, Cheltenham, Stereophonics, Liverpool, would have been allowed in France, for example, where public gatherings of more than 1,000 people had been banned on March the 8th. In Ireland, St Patrick's Day parades were cancelled. That was March the 17th. Other countries were going even further. Italy, where admittedly the pandemic was much more advanced, went into nationwide lockdown on the 9th of March. And here's Spain's Prime Minister making a national address on the 16th of March, as Boris Johnson was telling Britons to avoid unnecessary travel from home. Pedro Sanchez announced a nationwide state of alarm, ordering people by law to stay at home. France followed suit one day later. It is important, though, to emphasise that the correlation between these decisions and the case numbers and death tolls is not exact. Angela Merkel in Germany waited. She ordered the lockdown on the 22nd of March, just one day before the UK. However, the UK government is, as I was saying, repeatedly arguing it's been guided by science. Ultimately, though, lockdown decisions and all decisions around this pandemic are made by the UK's political leaders, the Prime Minister and his colleagues. Here's our political correspondent, Rob Watson.
I think on the one hand, the good news for the government, if you like, amidst the bad news over its perceived mistakes in handling the crisis, is that there doesn't seem to be, Ros, a sort of a smoking gun where one scientist said to Boris Johnson or some other minister, hey, if you don't do this right away, all hell is going to break loose. So there isn't a smoking gun in that sense. But I think what you have is a sort of growing sense of a sort of amateurishness about the way the British government handled this, and a sense as well that the government very much over-promised and under-delivered. And if you don't mind, I thought I'd pick this out because I thought it was quite revealing of something Mr. Johnson said on March the 2nd. And that is, he said, this country is very, very well prepared. We've got fantastic testing, amazing surveillance of the spread of disease. So there's that sort of sense all along that the government was over-promising, suggesting that it was completely in control, while the evidence suggests that it was not quite that way.
Next, we need to look at testing. As countries around the world grappled with the expansion of the pandemic, the World Health Organization was saying this on March the 16th.
We have a simple message for all countries: test, test, test.
The WHO was recommending testing people who had come into contact with those who definitely had the virus. The UK, though, took a different approach. This was March the 26th.
There comes a point in a pandemic where that is not an appropriate intervention, and that is the point really where we moved into delay, and although we still do some contact tracing and testing, for example in high-risk areas like prisons or care homes, that is not an appropriate mechanism as we go forward.
The UK has since acknowledged it abandoned track and trace in the early stages of the pandemic, not out of choice, but because it simply didn't have the testing capacity. Some other European countries did. Germany, for example, was testing 400,000 people a week early on in March, just when the virus was spreading quickly. And unlike in Britain, you didn't have to have coronavirus symptoms to get a test. Now, we should say the UK wasn't the only country that was struggling with testing capacity. Here's one of President Macron's key scientific advisors saying France failed on testing in February because it didn't have enough of them. And back in the UK, a huge effort was underway to grow that testing capacity. By the end of April, the government was saying this.
I can announce that we have met our goal. The number of tests yesterday, on the last day of April, was 122,347. This unprecedented expansion in British testing capability is an incredible achievement.
The UK, by this point, did have significant testing capacity, even if those figures referenced in that clip were increased by counting tests that had been sent out as well as tests that had definitely been taken. Now, you may remember hearing the Deputy Chief Medical Officer just then saying that contact tracing was not an appropriate mechanism for the point in the pandemic that had been reached. Well, there's been a shift on that from the UK government. By the end of May, the Health Secretary was saying this: NHS test and trace will be vital to stopping the spread of the virus. So from not appropriate from one advisor to vital. Here's the BBC's Naomi Grimley on how that effort has gone so far.
Boris Johnson promised a world-beating test and trace system, but the reality is very few experts would describe it as such as it stands now. Let's take the government app. The government said it wanted to develop its own app via the digital wing of NHS England. And at the time, many technology experts questioned that and said they should be following the lead of other countries and talking to the tech giants Google and Apple. Well, ministers were very bullish about their own app, and it was launched with great fanfare as a trial on the Isle of Wight off the south coast. As time ticked on, ministers seemed to talk about it less and less, and in early June it was described as just the cherry on the cake. Then, in an embarrassing U-turn, the NHS app was actually ditched, and ministers announced they would embrace the framework provided by Google and Apple. But we've already been warned that this app won't be appearing till the autumn at least.
In the meantime, the government very much focused on pulling together a huge team of human contact tracers. However, that system was launched with teething problems. In the first full week in England, tracers managed to get details from a third of people who tested positive for the virus, though that figure has since risen. Here's the government during the second week of the system.
I think that the system has worked well, and to get 2/3 in the first week of operation, it beat my expectations, and then to have the vast majority, 85% of the contacts that were given, self-isolating, that beat my expectations too. And this system gets better and better.
Here's Naomi Grimley again.
We're now told that over 100,000 people in England have been asked to self-isolate by the contact tracers. That's after the service received the details of 20,000 people who tested positive. But 1 in 4 people who are asked to self-isolate don't play ball with the system. Critics of this system say that we still don't know how fast it's tracing people, and many of the government's own scientific advisors worry that the system won't be running at full throttle for several weeks yet. That's despite the fact that England is now emerging from lockdown.
Let's continue our close look at how the UK's handled the pandemic. The timing of the lockdown was crucial. The UK's test, track and trace capacity was crucial. And so was what happened with the UK's care homes. More than 16,000 people have died from COVID-19 in these care homes, according to official statistics. That's almost a third of the overall total of fatalities. In fact, the virus has claimed the lives of more than 5% of the care home population. That figure's from the London School of Economics, and it's the highest in Europe except for Spain. And if we look at England, one decision seems central. For the month beginning March the 17th, 25,000 people were discharged from hospital to care homes without a coronavirus test. Those are official figures. By the end of that period, almost 1,000 homes had reported infections. The care home industry looks back at that like this.
Our focus at the start of this pandemic was clearly the NHS, and there was not a recognition in either the planning process that happened in 2016 or indeed in this current pandemic at the very start of it, that the most vulnerable people were in care homes.
Some of our problems around transmission, no doubt, are relating to PPE and very sadly, some of the deaths too.
This has been a health pandemic, and what we haven't felt in the care sector is that we've had a health response.
While the government has consistently said it did prioritise the care home sector, here's one minister in May.
We don't accept the caricature that we took an approach that was wrong. Very early on in this epidemic, we had protocols in place for care homes. There was guidance as to how they should approach things. As the situation developed, then more stringent policies were introduced.
So many factors have contributed to the UK having the worst outbreak per head of population than any other country in the G20. And of course, the outbreak is still going on. This shows the number of deaths per day in the later stages of each country's outbreak. The chart starts on day 60. You can see by this point that France and Italy have pushed their curve well down, as has the UK, but it continued to record over 100 deaths a day for longer than those two countries. So with all of that in mind, what do people in the UK make of the government's response? Here's Rob Watson again.
There's no doubt at the start, indeed as it happens in countries around the world, whenever there's a tremendous crisis, what do people do? They look to those in authority, and Mr Johnson and the government had sky-high ratings. That has fallen by 20 percentage points, according to YouGov, a polling firm here in the UK. And I think one can tie some of that to the incident involving Mr Johnson's most senior advisor, Dominic Cummings, when he was seen to have at least sort of flouted the spirit of the lockdown regulations, and a sense, of course, that the government was finding it was sending out mixed messages as to how it emerged from the lockdown, and of course just the fact that the UK has the highest number of deaths in Europe.
I want to ask you about a couple of developments today, Rob. First of all, the city of Leicester is now experiencing the first local lockdown of this crisis, and I guess that's a sign that we're shifting into a new stage now.
Yes, I suppose on the one hand, it's sort of it helps the government making its point to people in the UK. Look, don't think that you can somehow drop your guard. This is evidence of how people still need to be very, very mindful of the health risk. On the bad side for the government, of course, this was the day where Boris Johnson was trying to sort of relaunch his government with a promise of a sort of big, bold approach to a post-COVID economic solution with build, 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 and this sort of eats into that message and may well, of course, make people more nervous about going back to work and doing the things that the government would like them to do.
I guess it does eat into that message, but nonetheless, would you agree that the announcements today by the Prime Minister, particularly from a Conservative Prime Minister, were enough to raise the eyebrows? There's a reasonable amount of money heading the way of various infrastructure projects.
Well, yes, raise eyebrows. I suppose one of the things that it does is that I guess it raises a question about a certain amount of ideological confusion for Conservatives. I mean, I think many will be asking, well, what is Mr Johnson? Is he, as he like to sort of portray himself, FDR, Mr Roosevelt, believing in big interventionist government? Or is someone who believes, as a lot of Brexiteers do, that the whole point of leaving the EU was for a low-tax, deregulated, more deregulated state. Rather interestingly, Mr. Johnson appeared to suggest he was in favour of both.